Many females complain of abdominal pain in pregnancy. Sometimes it is severe, sometimes it is just cramps. Many are worried whether this pain is normal or not. What are the causes of abdominal pain in pregnancy? What can be done for abdominal pain in pregnancy? Good morning, I am Dr. Rajat and you have started watching our YouTube channel, The Fertility Gynecologist. So, why pain in abdomen or abdominal pain occurs in pregnancy? There are many causes. The first and foremost is purely physical. This is a non-gravid or a non-pregnant uterus. It is very small. The size of non-pregnant uterus is roughly the size of fist. As and when the pregnancy implants in the uterus expands, and that expanding or increasing in the size of uterus leads to a stretching pain, which is the most common cause of pain in pregnancy. Apart from that, most common cause of pain in pregnancy is some hormonal changes, which is mostly because of progesterone related things. Progesterone is a pro-pregnancy hormone. It also causes intestinal stasis, that means decrease in the intestinal motility, which can lead to slight bloating, slight gaseous distension and slight constipation, which may again contribute to the abdominal pain in pregnancy. Like I said, it is because of the uterine expansion. Expansion of uterus leads to the stretching of ligaments. Those ligaments contain various nerves and blood vessels and they lead to the stretching pain. There is also something called as a round ligament pain. Now this uterus on the anterior side to the lateral pelvic wall is suspended, connected to the pelvis with a round ligament kind of structure, and as the uterus expands, it expands in the cavity, that round ligament also stretches and that leads to an entity called as a round ligament pain. It is mostly between 18 to 24 weeks, that means between 4th to 7th month. And like I said, digestive issues. Apart from that, non-gynec causes. It can be appendicitis pain, it can be a renal pain. If the patient has fibroid before, then it can be a red degeneration of fibroid also. So these all things lead to the abdominal pain. So first of all, whenever a patient calls us with abdominal pain, we first of all see what is the duration of pregnancy. If it is first 3 months of pregnancy, 4th to 6th month of pregnancy, or 7th to 9th month of pregnancy. If it is a 1st to 3 month of pregnancy, mostly the pain is in crampy in nature or a stretching kind of pain. Usually such kind of pains are absolutely normal. They are abnormal only if those pain are associated with spotting or bleeding PV. That can be a suggestive of a threatened abortion or some kind of an ectopic pregnancy. So we have to do an ultrasound, do an examination and then manage accordingly. Most of the times between 4th to 6th month, the pain is because of the stretching of uterus, like I said, and the round ligament pain between 18 to 24 weeks. There would be occasional aches and pains, but if it is a lower abdominal pain, then first thing we have to rule out is a urinary tract infection, because the urinary bladder sits on top of the uterus, and any kind of pain in the any kind of pain in lower abdomen, especially near below the umbilicus, is suggestive of a urinary tract infection. So or a cystitis. So we have to rule out urinary tract infection, treat if it is there, and the pain would get relief. The last trimester pain is what we are worried about, because the last trimester pains means that patient can end up in a preterm labor, or it is suggestive of a normal delivery pain. There is also one kind of pain which is normal, absolutely physiological, which is called as a Braxton Hicks contraction. Somewhere about 24 weeks onwards, the uterus tightens and then becomes soft. That tightening of uterus is called as a Braxton Hicks contraction. Initially it is say maybe 1 or twice per day. As the pregnancy grows, the frequency increases to about 5, 10, 20 times a day. The duration is initially 1, 2, 3 seconds and later it increases later on. And as the term approaches, as the delivery date approaches, due date approaches, the same Braxton Hicks contraction turn into the labor pain and which lead to the onset of labor. So Braxton Hicks contraction are absolutely physiological. They are normal things and you do not have to worry about those kind of things. Early pregnancy because of the implantation causes some kind of menstrual cramps that can lead to an abdominal pain. Baby position usually does not cause abdominal pain, but sometimes if the baby is breech means head is here, so because head is very hard bony structure, it can sometimes lead to a discomfort here, or sometimes if the elbow or the ankle or the knee is somewhat pointing inside the abdomen, then sometimes that can be a bit discomforting. Some patients find the moment of fetus relatively discomfort, or sometimes they lead to pain. Again, there has nothing to do about what should one do if there is abdominal pain. We always tell our patients dicyclomine, paracetamol is the best painkiller in pregnancy, but first of all they have to tolerate the pain. They have to see, wait, change the position. If they are lying down, maybe sit, maybe walk slightly gently, have some water, take some antacids, it may be a gaseous distension. If patient is having difficulty in passing stool or there is a hard passage of stool, then maybe some stool softeners, plenty of fiber diet, all those things need to be taken. If in spite of take a hot shower bath, if in spite of all these things the pain is not relief, then one can safely take a dicyclomine paracetamol tablet, either dicyclomine plain, paracetamol plain, or what we tell a world famous brand cyclopam can be taken in the pregnancy. It is absolutely safe. If in spite of taking that pain relief tablet the pain is not relief, then you need to consult your doctors. So what to do? Take a warm water bath, rest until you feel better, change your position. If you have digestive discomfort, take some antacid, Gelusil, something kind of thing, and do some massage. These things may be helping. If the patient is having abdominal pain after 8 months, in 9th month, then how to know whether it is a labor pain or not? Now there are two things which we were told when we were doing our gynec residency. There is a false labor pain and there is a true labor pain. False labor pain means that there would be pain in abdomen, but that would not be associated with the progress of labor. That means it is not a pain which is initiating the labor. True labor pain is associated with dilatation of cervix, associated with passage of shaw, and most important thing, while false labor pain can be relieved by a medication like cyclopam, true labor pain is not relieved by a medication like a cyclopam. One thing at this point in video I would like to tell, please do not take a tablet which contains NSAIDs like COMBIFLAM, Brufen, Voveran, diclofenac. It is an absolutely no for any kind of pain in pregnancy. Only tablet which is good is either dicyclomine or paracetamol. Please do not take COMBIFLAM in pregnancy. Please do not take Brufen in pregnancy. Please do not take diclofenac in pregnancy for any kind of pain. Even if somebody has a muscle pain or a fracture pain or a wound pain, we advise only localized application, hot water bag, or local application of an analgesic. No systemic, no oral, no injectable diclofenac, Voveran, no injectable Brufen, nothing. This is very important. This message has to be carried. This can lead to a premature closure of patent ductus arteriosus. This can lead to heart problems in the baby. Now, many people say how much abdominal pain is normal. Like I say, normally most of the times abdominal pain usually subsides within few minutes by the change of position, by increased fluid intake. If it persists for a day, even after taking cyclopam tablet twice or thrice daily, then you should maybe meet your doctor. Is pain safe in pregnancy? I would not say safe in pregnancy, but it mostly you do not have to worry for occasional aches and pains. How to stop the abdominal pain? First of all, You have to look for the source of abdominal pain. If it is a crampy abdominal pain, like this season, June, July, August, what we have found is most of the patients are having just gastrointestinal infection, gastroenteritis, that is mostly caused by either having food from outside, unhygienic food from laris, or having some kind of processed food like pizzas, pani puri, samosas, farsan, or drinking non-boiled water. Most of the patients tell us, okay, sir, we are drinking RO water, but I firmly insist on having boiled water. It should not be warm water, it should be boiled and then cooled water. It is the best way to have a disinfected water for drinking. Even if you are drinking a RO or a mineral water, it has to be boiled, especially in this season, in monsoon season, June, July, August, September. So gastrointestinal infection, gastroenteritis again has to be ruled out for a abdominal pain. Most of the patients are worried 4th month, 5th month कि सर मेरा बच्चा नीचे आ गया है, आप देख लो, please see if the baby has come down. There is, for me, it is a simple thing. There is no entity called as baby has come down. What we do is, for any patient who comes to us with complaint of abdominal pain, we just simply do a transvaginal sonography, look for a cervical length. If that cervical length is more than 3.5 centimeter, we do not have to worry. There is nothing, no fear of abortion, no fear of preterm labor, no fear of delivery also, because cervix has to become short before delivery. It has to become effaced and then dilated before delivery. So if cervical length is normal, there is 99% chance that there is not going to be preterm labor or abortion or labor pain. So you do not have to worry about those kind of things. Another thing is a previous seizure or a previous to seizure patients, they often complain of pain at stitch line. If the patients where the scar of the seizure is taken, that patient has to be taken seriously, especially after 34-35 weeks. In early pregnancy, if the pain is a stitch line, you can give occasional painkillers, you can do a urine routine micro, you can go for treatment of urinary infection. Again, like I said, in every patient you have to do urine routine micro, you have to rule out the vaginal infection, you have to rule out, take the cervical length measurement and do accordingly. But if at full term previous seizure patient is complaining of lower abdominal pain, especially at stitch line, you have to take that patient seriously. You have to monitor the pulse of the patient, you have to look for cervical length, you have to rule out urinary infection. And I forgot, even the vaginal infection is also a very important cause of lower abdominal pain. Vaginitis, white discharge, itching, PV, burning, micturition, all these tend to cause cervicitis followed by infection of uterus, and that leads to a lower abdominal pain. So that also has to be treated promptly, otherwise that may end up in preterm or a labor pain. Sometimes even the surgical cause, like I said, have to be kept in mind. Appendicitis has to be kept in mind. You can get an ultrasound done. If that appendicitis is there, need to admit the patient, go for a injectable antibiotic or antibiotics course. And if it is second trimester, between 4 to 6 months, if there is a rupture of appendix, maybe a laparoscopic appendicectomy can be done. Normally we do not do surgery in first trimester of pregnancy or in the last trimester of pregnancy. So can abdominal pain harm the baby? In clear cut words, no. Routine, I always tell my patient, routine aches and pains are part and parcel of pregnancy. You have to learn to live with it. There is also something called as a symphysis pubic pain. There are back pains. All those things are going to be there in pregnancy. You have to manage. You have to learn learn the art of managing the pain in pregnancy. Only thing is, you should know which pain is serious, which pain needs to be to have a doctor visit. It is very important. Usually pain, suppose the patient has conceived, when the pain starts, the pain usually starts 1 to 2 weeks after the pregnancy. So again, I have told you there are 3 main causes of pain in pregnancy: round ligament pain, Braxton Hicks contraction, and gas and constipation. First thing is gas and constipation, you have to rule out in pregnancy. Second thing is Braxton Hicks contraction. Third thing is round ligament pain, and then last we come to a preterm labor pain or the true labor pain. Again, how to manage at home: rest until you feel better, change of posture, take a hot water bath, try some kind of a massage, take some carminative, you can take some whatever, anything kind of which promotes digestion. At your home you can have a Eno, you can have a soda, you can have a antacid syrup. Because most, like I said, pregnancy has a progesterone component. Progesterone leads to the decrease in motility of intestines. There is a decreased gastric emptying time, increased gastric emptying time. That means the food stays for the longer time in the abdomen, in the stomach. It leads to acidity, burning chest. It stays longer time in the intestines are bloated, they are usually filled with gas, there is decreased passage of stool because of progesterone and because of pressure of the gravid uterus, so there is constipation. Again, modern lifestyle, we are using western toilets again promote constipation. So all these things in combined lead to a abdominal distension, abdominal pain, bad bowel habits. Again, most of us nowadays take less fluid, less fiber, and more processed food. All these things in combination, they are a bad thing for our gastrointestinal tract. They lead to the abdominal pain. So the carry home message of this video: abdominal pain is part and parcel of pregnancy. You have to learn to live with aches and pains in pregnancy. You should just know and master the art of managing the pain in pregnancy. Just know what are the signs when you need to visit a doctor. Always have a tablet cyclopam with you. COMBIFLAM should not be taken in pregnancy. Hope you liked the video. Please like the video, subscribe to our channel and share the video. Namaskar. Bye bye.